medical exam then is our passive mobility tests. And realistically, there's only a couple of things that we have to worry about here with this. The easy part to start out with is checking for the ability of the pelvis to anteriorly or posteriorly rotate, depending on which side we're concerned with, right? So on Michelle, we were looking at her right side as potentially being anteriorly rotated, not able to rotate posteriorly. So depending on your preference here, some people prefer to be across the table from the side that they're trying to diagnose. Some people prefer to be on the same side. I usually end up on the same side. The biggest thing is that I test both sides from the same position. So if I'm testing her right side while I'm standing on her right side, I have to make sure that I test her left side while I'm standing on her left side. Okay, because the change in angle vector of where my arm is relative to the innominate, we want it to be the same for both sides. Okay, so what I would do is I'd get right onto the ASIS here on both sides, superior portion on her left, inferior portion on her right, and I'm going to fixate the left side and try and rotate the right side around that. All right, so my vector is basically that direction. Okay. If I wanted to check for anterior rotation, I just switch my handhold here, inferior portion on this side, superior portion on this side, and I'm following my index finger, if you can see that there, and we're just going to rotate anteriorly as I fixate her left side. And what I'm noticing on her, right, we've talked about the potential for non-fixated or non-sublux lesions. This does move on the right side. So odds are pretty good that this joint, this sacroiliac joint, is not jammed. That it's probably being held by some sort of motor tone change, okay, which may suggest, like we said, either a long thoracic paraspinal tone change or maybe some sort of sacral torsion involved. Okay, and then in order to adjust this, I would switch sides and I'd test the opposite side. Right? Okay.